So at this point, we would normally scan the barcode on the patient's wristband and then the barcode that is also on the labels that you would put on the syringes. But in this situation, we are just gonna go with the labels that I placed there and the patient's wristband. So I will position the patient now. I'll have her sit up so that I can administer the influenza vaccine to one of her arms. And this is where I ask her which hand is her dominant hand. We'll go with that she's right-handed. And so then we will administer the flu vaccine into the non-dominant arm. And then I would ask her where she got her last vitamin B12 injection, if she remembers. If it was in her abdomen, I would ask her which side, also her arms or legs as well. So we'll go with that she last got her injection in her left side of her abdomen. So this time we will inject it on the right side of the abdomen. That way she can still be seated in the upright position. Okay, so now I will wash my hands again. Okay, put my gloves on. Not an easy task after you use hand sanitizer. Okay, use my patient arm here. So we will go with that. This area is the top of Anna's arm, right here. So this is where we will be administering the flu vaccine. So I will uncap my needle now. And I just want to kind of place my fingers in the area. Let me recap my needle really quick so that I can clean the area first. So to clean the area, you'll want to just take an alcohol pad and you'll start in the middle and work your way about 2 inches out, rubbing and cleaning for about 30 seconds. For these purposes, I will just do 15, but normally in the setting, you would be doing 30 seconds. Okay, now I can uncap my needle again. So you let it dry, and then you just place at least 2 fingers so that you can visualize your injection site, and then we will inject the needle. And now you can dispense with the plunger the medication to the patient. And you want to hold it for about 5 to 10 seconds so that the muscle can absorb the medication before releasing it, so that the medication doesn't come out from the hole that was made from the injection. Okay. And normally I would enhance the safety of the needle, but for these purposes, I'm just going to recap it. Okay, and now we will move on to the vitamin B12. So just gonna use this end as Anna's abdomen. So again, you wanna clean the injection site, starting in the middle and working your way around about 2 inches for 30 seconds. Okay. And I'll uncap my needle. And now you'll want to pinch for this subcutaneous injection and place the needle into the patient like a dart at a 90-degree angle. And then before pressing on the plunger to dispense the medication, you want to release the pinch that you have, still leaving your fingers on the patient, and then injecting it very slowly. And again, leaving it in for about 5 or so seconds so that the area can absorb the medication. And again, I would enhance my safety on the needle, but for these cases, I'm just going to cap it. Okay, and now I can my gloves off. At this point, I have placed my needles in the sharps container, and I will clear all of my other supplies that I brought in. So my gloves, my gauze, and the alcohol pads that I use will be placed in the trash, and any other belongings of mine will come back with me. I will make sure that the patient is comfortable, that she doesn't need anything, water, blanket, or to use the restroom. I will also make sure that the patient is comfortable. If she wants to lay back down, we can lay her back down. If she wants to stay seated up, we can leave her seated up. Making sure that the bed is in the lowest position again, that the brakes are on, and that at least 2 side rails are up, that the call light is in place, and if she needs anything or experiences any of the reactions that I went over, to call out. I will push the curtain, and I will wash my hands, and I will make sure that the medications that I just administered are documented correctly, along with any assessments that I went over. And yeah, open the door, wash my hands again,